All around the world, the honeybee holds a special place in human life. It brings us not only the sweet golden honey that so many enjoy, but also an entire treasury of natural substances, refined through thousands of years of evolution. From the beehive, we collect propolis, the bee's own protective shield against disease, viruses, and fungal attacks, long valued by humans for its antibacterial qualities. Like propolis, honey, beeswax, and drone larvae, the bee's treasure chamber also holds bee pollen, a nutrient-rich superfood packed with vitamins, enzymes, and minerals. It is also home to royal jelly, nature's own powerful remedy, valued by humans for centuries for its health-supporting qualities. But one of the bee's most powerful and most controversial products is bee venom. Bee venom becomes a fascinating complement to conventional medicine. And across the globe, researchers are exploring how this remarkable natural compound might aid in the fight against a wide range of diseases. At the International Beekeeping Conference held in Copenhagen in September 2025, experts from all over the world gathered to share their knowledge and experience. Among them were apitherapists, specialists who use bee products in the treatment of human diseases. They presented their research, clinical studies, and hands-on work with apitherapy. Among the many presentations on apitherapy, one speaker stood out in particular, Dr. Stanko Buha from Bosnia and Herzegovina. Drawing on both research findings and clinical experience, he presented compelling and convincing evidence of the therapeutic effects of bee venom treatment. My film partner and I gladly accepted Stanko's warm invitation and soon set off, driven by curiosity and a quiet sense of hope. Treating people with bee venom seemed almost unreal. That those burdened by severe illness could find relief through tiny drops of venom was something we had to see for ourselves with open minds. In the small town of Trebinje, in the southern part of Bosnia and Herzegovina, Stanko runs his modest clinic, which he founded in 2021. His foundation for practicing bee venom therapy comes from 35 years as a senior anesthesiologist at the local hospital, along with 3 decades of experience as an acupuncturist. Today, he welcomes patients not only from the surrounding region, but also from abroad, many traveling great distances to seek his care.
The last 4 years, I switched to apitherapy, in fact, apitoxinotherapy. It happened just by case. It wasn't my plan. But since a long time ago, I know for apitherapy, and I'm somehow fond of it because my father-in-law was quite big and famous beekeeper. He spoiled me with apitherapy.
Stanko Buha treats patients with serious conditions such as multiple sclerosis, Parkinson's disease, and paralysis following strokes, using bee venom injected into acupuncture points on the body. One of Stanko's acupuncture patients, who suffered from multiple sclerosis, asked him to inject bee venom at the same points where he normally placed the acupuncture needles. She offered to provide the venom herself. After 20 sessions of bee venom therapy, the woman has been functioning normally. The neurologist rated her EDSS score as 1 meaning no disability and only minimal neurological signs in her legs. She has not taken any medication since the end of the bee venom treatment.
How would I gather patients at all and deliver the knowledge about the therapy and deliver the information that I was doing this therapy? I went to multiple sclerosis associations. So I did the presentation in neighboring area, in my area in Eastern Herzegovina, and neighboring areas in Croatia, so Dubrovnik county, and in Montenegro. I offered them 5 treatments for free, so that they could try and decide whether they would continue with therapy or stop according to if they are or not effects, if it's too expensive, etc. I learned in the meantime about the therapy of multiple sclerosis, and they were persuaded in the effects. Obviously, only 1 or 2 of them quit the therapy from the beginning.
Djeluje, našto bila mi je skroz ova ruka, nisam mogao sam, nisam mogao prste ispružiti.
It works, he said. The right arm, he couldn't do anything with the right arm. With this movement, and he couldn't do with fingers. The fingers were like this.
In Bosnia and Herzegovina, there is no legislation regulating bee venom therapy. Across Europe, the rules differ widely. Some countries impose strict requirements and specialized training, while others have almost no specific regulation. This creates a patchwork of approaches that makes it challenging to build consistent, practical, and clinical experience. If a patient suffers from a severe allergy to bee stings, even the slightest treatment can pose a serious risk. The reaction can be intense and, in the worst cases, life-threatening. That is why Stanko never compromises on safety. Before every single treatment, he always performs a thorough allergy test.
This is something that we do not skip ever, and I'm never starting therapy alone, always with another person, usually anesthetic nurse. Then we proceed with the treatment after the test, or half an hour after the test. On average 18, let's say, bee stings per treatment. We start with small number, then we increase from treatment to treatment. Sometimes up to 40 per treatment. So the first priority is safety, then efficiency, then price, of course, And the last priority, but we managed to do it always, is comfort of the patient. Comfort we provide with anesthesia, in fact general anesthesia, because I'm an anesthesiologist. And it was shown that not allergy is the main problem, but the pain for our patients. So I'm solving this problem with pain with short time analogous sedation, which patients call it anesthesia, but it's not deep anesthesia because the patients are communicable. Not so difficult, let's say, to sustain, but enough to undertake this pain. She won't remember anything after the treatment.
Saška, dvoku doktore više zažete bolu.
Molim?
Ne mogu zažete bolu. Potreban.
Patient is communicating almost all the time. Reacting, the patient. Podići nogu. So the patient is reacting on the simple commands. Okay, spusti nogu. Spusti nogu.
So she hears what you are saying?
Yes, it's not that deep unconsciousness, but enough deep to be safe and comfortable for patients.
Yes, yes. To relieve the pain.
Yeah.
This patient was diagnosed with Parkinson's disease 5 years ago. He received treatment at a hospital, but despite this, the disease progressed rapidly and his symptoms continued to worsen.
Počeli se znači pre mjesec dana i za ovih mjesec dana kako osjećate da je efekat od terapije?
Pa osjeća se poboljšanje. Naročito pokretljivosti u tim finim pokretima. Nije to neko poboljšanje visokog procenta, ali se osjeti.
Dobro, znači idemo zvanično da vas pitam. Kako vi vidite Rankovu terapiju, pošto ste ga znali prije terapije i sada poslije mjesec dana?
Pa recimo, ja sam najprije primetila njegov hod, da on ide bolje, da bolje hoda, pokreti nogu su mu bolji i više može izdržati te neke šetnje. Pa primetili smo recimo njegov govor, naprednost bolje ima, lakše ga je razumeti kad priča i to isto neki napredak.
Okay.
Mnogo uspravnije hoda, prosto je onako išao povijen, glava napred, a sad uspravan hod mu je, uspravnije ima držanje tela. Pa još što je Ranko primetio prilikom nokte kad secka, pokretnije mu je ruka i poruku kad piše desnom rukom osjeti da i tu ima poboljšanje, da bolje funkcionišu mu prsti prilikom pisanja poruka na telefon.
Da li se slažete s ovim što je vaša sestra rekla?
Da.
Yes. Yes.
Ranko lives 9 hours' drive from Stanko's clinic. His entire family takes part in supporting his healing process. They take turns driving him to his treatments and stay for a couple of days in the town of Trubinji before bringing him back home.
Besides multiple sclerosis, patients that used to come to my clinics are from Parkinson's diseases, stroke or post-stroke complications, Alzheimer's disease, amyotrophic lateral sclerosis, which means motor neuron disease, which is one, if not the worst, neuromuscular disease. Then rheumatic diseases, especially rheumatoid arthritis. In honeybee venom, melittin is the main substance, and it is well known what melittin is doing. It is the strongest natural immunomodulator, let's say. So, melittin is modulating or suppress the activity of nuclear factor kappa B or protein 65, which is well known as one of the reason, let's say, or trigger factor for tumors, for example. Melittin is also inhibiting protein 38 mitogen activator kinase, which is also one path, let's say, to tumors and inflammation. But this is medicine. So it has nothing to do with the belief, whether you believe in bee venom therapy or not. It is effective despite of your not belief, let's say.
At present, global research has not yet reached clinical trials involving patients for the use of bee venom in cancer treatment. However, researchers at the Harry Perkins Institute of Medical Research in Perth, Australia, have shown that melittin, a key component of honeybee venom, kills cancer cells in laboratory models and can enhance the effect of conventional chemotherapy, reducing cancer cell growth more effectively than chemotherapy alone.
Concerning the future of this kind of therapy, apitherapy at all, especially bee venom therapy, I think the future is bright for patients. Patients that don't have medicines or don't have hope at the moment, could believe in bee venom therapy and apitherapy at all, and expect the solution for their disease.
Each time he is receiving about 35, 40 bee stings,